In this podcast episode, Dr. Darren Candow, a leading expert on creatine research, explores the multifaceted benefits of creatine supplementation beyond its traditional role in muscle building. The discussion covers creatine's impact on muscle health, bone density, brain function, inflammation, neurodegenerative diseases, mental health, and aging. Dr. Candow also addresses common myths, proper dosing strategies, exercise, nutrition, and practical advice for integrating creatine into daily life. Creatine is naturally synthesized in the liver and brain and stored primarily in skeletal muscle, where it supports energy production. While a healthy brain generally synthesizes enough creatine, metabolic stressors such as sleep deprivation, shift work, or intense mental exertion increase the brain's demand for creatine supplementation. These conditions challenge normal ATP availability and signal the need for higher creatine doses, which can aid cognitive performance and recovery. Dr. Candow emphasizes that the more stressed the brain is, the larger the supplemental dose required, with some studies showing acute benefits at doses up to 20 to 30 grams. Dr. Candow's extensive research, including over 120 published papers and dozens of studies in his lab, suggests creatine is safe for nearly everyone. There are no convincing contraindications for healthy individuals, although those with pre-existing conditions should consult their doctors. Pregnant women's safety data is limited but appears promising. Children and adolescents can also benefit from supplementation, with at least 1 gram daily recommended to support bone and muscle development. Vegans and vegetarians who lack dietary creatine from animal products often respond even better to supplementation. Creatine has been stigmatized by several myths, which Dr. Candow systematically dispels. These include the false beliefs that creatine damages kidneys, causes water retention and bloating, is only effective for men, leads to hair loss, and causes muscle cramps. He explains that elevated creatinine levels in blood tests often mislead physicians, but creatine has no harmful kidney effects. Initial water retention from loading phases is transient and actually supports muscle protein synthesis. Women respond robustly to creatine, gaining strength and losing fat. The hair loss myth originates from a single study linking creatine to increased DHT hormone within normal biological ranges, but without evidence of hair follicle damage. Moreover, creatine enhances hydration, which can reduce muscle cramps rather than causing them. Supplementing with about 5 grams of creatine daily alongside weight training enhances muscle mass, strength, power, and endurance across all ages. Creatine increases training volume by allowing individuals to perform more reps and sets, thereby accelerating muscle hypertrophy and functional gains. The gain in lean mass averages around 1 to 2 kilograms over several weeks, with half of that accounting for muscle tissue. Creatine also decreases protein breakdown, helping maintain muscle integrity and speeding recovery. While loading phases can saturate muscles faster, daily low doses remain effective and better tolerated. Creatine monohydrate is the most studied and effective form, despite the market offering various alternatives like creatine hydrochloride and gummies. Consumers should seek products labeled with CreaPure, a high-quality German-manufactured monohydrate and certified by third-party agencies such as NSF to ensure purity and efficacy. Ingesting creatine in smaller doses spread throughout the day, microdosing, improves tolerance and reduces side effects like stomach upset or dizziness, which can occur with larger single doses. Mixing creatine into beverages, including water or coffee, in moderate caffeine amounts helps maintain consistent intake. Bone benefits require slightly higher dosages, generally 8 to 12 grams daily, combined with weight-bearing exercise. Creatine contributes to maintaining bone mineral density and structural integrity, especially among postmenopausal women, potentially slowing age-related bone loss and reducing fracture risk. The mechanism likely involves energizing bone-building cells and suppressing bone-resorbing osteoclasts, somewhat paralleling pharmaceutical bisphosphonates, but without drug-related side effects. Regular strength training is essential to realize these bone benefits. The brain utilizes a significant portion of daily energy, and creatine supports this by buffering ATP levels. While a healthy brain typically synthesizes adequate creatine, Cognitive or metabolic stress, such as sleep deprivation, intense mental effort, or neurodegenerative disorders, increases the brain's need externally. High-dose supplementation, around 20 grams, has been shown to elevate brain creatine levels and improve performance on demanding cognitive tasks like the Stroop test after sleep deprivation. Creatine may not produce immediately noticeable effects, but supports memory, processing speed, and mental fatigue resilience. Emerging research points toward creatine's potential role in recovery after brain injury, stroke, and aging-related cognitive decline. Creatine supplementation shows promise as an adjunct therapy in conditions like Alzheimer's disease and clinical depression. Studies demonstrate modest improvements in cognition and physical function, e.g., grip strength, in Alzheimer's patients taking 20 grams daily. In depression, creatine combined with antidepressants has doubled remission rates compared to medication alone. These benefits are thought to arise from improved brain bioenergetics, reduced inflammation, and enhanced neuroplasticity via proteins like BDNF. Although more placebo-controlled trials are needed, creatine forms a hopeful part of the neurological and psychiatric treatment toolbox. Creatine provides anti-inflammatory effects, particularly during prolonged or intense exercise, such as triathlons or Ironman events. Although not a direct anti-inflammatory drug like ibuprofen, creatine reduces markers of muscle damage and systemic inflammation, promoting faster recovery and less pain. These properties may contribute indirectly to improved performance and health span by mitigating chronic low-grade inflammation associated with aging and overtraining. Weight training is the cornerstone of maintaining muscle mass, strength, and functional capacity as people age. Dr. Candow argues weightlifting surpasses cardiovascular exercise in preserving muscle and boosting longevity markers. However, combining both exercise types provides the broadest benefits. Practical guidelines suggest at least 2 sessions of whole-body resistance training per week, paired with at least 150 minutes of moderate cardiovascular activity. Muscle loss accelerates dramatically after age 40 in sedentary individuals, but regular weight training combined with creatine supplementation significantly blunts this decline at any age. Protein and creatine work synergistically to enhance muscle growth and functional outcomes. Most adults meeting typical protein targets, 1.2 to 1.6 grams per gram day, consume adequate amounts for muscle health, provided the protein quality is sufficient. Vegetarians and vegans may require additional intake or combinations of plant proteins to cover essential amino acids. Creatine supplementation acts as a force multiplier when combined with adequate protein and resistance exercise, fostering meaningful improvements in lean mass and strength. Consistency in creatine intake is essential, but can be challenging due to lack of immediate noticeable effects. Dr. Candow advises embedding creatine supplementation into daily routines, such as keeping it near regularly used items, coffee machine, desk, or using gummies for convenience and taste. The timing of creatine intake is flexible. Research shows no significant difference whether consumed pre-workout, post-workout, or at bedtime. Spreading doses across the day or mixing creatine into beverages improves tolerability, especially for those sensitive to high single doses. Aging is characterized by progressive declines in muscle mass, strength, and physiological resilience. Creatine, combined with proper exercise and nutrition, is positioned as a key tool in extending health span, the period of life spent free from chronic disease and disability. While creatine alone is not a panacea, Dr. Candow advocates its inclusion alongside weight training to help people live better and maintain independence well into older age. He also highlights the profound emotional motivation behind his research, the fear of aging and death, and the desire to optimize the time we have. Dr. Candow expresses keen interest in creatine's applications beyond traditional domains, such as its potential prophylactic use in head trauma to reduce concussion severity and chronic traumatic encephalopathy, CTE. He is also intrigued by exploring optimal dosing tailored to individual needs based on factors like body size, metabolic stress, and lifestyle. Despite decades of research, many questions remain, particularly regarding brain creatine kinetics and long-term cognitive benefits. Besides creatine, Dr. Candow supplements daily with probiotics, magnesium twice daily for cognitive and muscular function, vitamin D, omega-3 fatty acids, and occasionally iron. He monitors emerging compounds like NAD plus precursors for future potential. This balanced approach highlights the importance of a multifaceted nutritional strategy for optimizing overall health alongside exercise and creatine supplementation.